Hi, I'm Arjen Westerink with VitalHealth Software. I'd like to show you a little bit of our VitalHealth EHR product. VitalHealth EHR is a cloud-based product. It runs inside any web browser, Firefox, Safari, IE, Chrome, on a PC, on a Mac, or also on an iPad. From a look and feel perspective, it's going to feel like you're working in a native iPad application. It was designed to look and operate like an iPad application with clear, large buttons. It's touch enabled, so you can just tap on something to open up. If you're coming into the EHR product, you would come into the medical record view. You can clearly see on the side which patients are due for a particular visit, who is currently waiting in the lobby, who is currently in consult, and all you do is just tap on a patient's name and it will open up the medical record for that particular patient. And your initial view on this patient is to get a quick overview of this patient's medical status. So you can see what their latest vitals were in the prior visit. You can see what diagnosis exists for this patient, what were their most recent labs, what's their current medication list, and a knowledge engine that's built in that gives you an overview of what preventive services, what immunizations are due for the patient, or what treatment recommendations there may be for the patient based on their medical condition. So if the patient has been diagnosed with diabetes, they haven't had an HbA1c test done in 3 months, it will tell you that an HbA1c test is due because this patient is diabetic. From here, what we try to make sure is that from an interface perspective, it is all very intuitive. So not a lot of clutter on the screens, and if you go to the various areas of the medical record, you will see a very consistent interface. So if I go to the clinical notes section of the medical record, you see a list of clinical notes here, and then a quick list on the side here on the left where you can narrow down on individual clinical notes by just filtering on them. So for instance, just acute visits, and it will just show you the acute visits. And that very same interface concept is consistent throughout the medical record. So if I go to the Labs tab, again I see that same interface, a list of records and the ability to view individual filters on these records. So I can see, for instance, all orders that have been placed, all tests that are part of these orders, any pending orders that are electronically submitted with the pending tests associated with that, or any electronic results that have been automatically populated into the medical record that I need to review. If a patient is waiting in the exam room, a nurse does not necessarily have to tee up the visit by going to all these individual records. He or she can just go to today's visit, start a new clinical note right from here, capture the chief complaint, update the history of preventive illness, of the present illness, update the allergies list, update the medications list. So we try to make sure that from a workflow perspective, you do not have to go all over the place. All the clinical workflow, we try to make sure that it's all captured within one screen, and the screens are dynamically adjusting to the situation of the patient. So depending on the condition that the patient has, the amount of information you capture dynamically adjusts to it. The solution is subscription based. We start at about $425 per physician. That includes access to for all supporting personnel. All you need is a good internet connection and either an iPad or a browser-based computer. It includes practice management functionality with all your reporting that you need for CMS reporting, meaningful use reporting. It includes scheduling and appointments, super bill generation, and of course all the medical record content. Thank you.